Well, what an honor for us today to have with us a very special guest. We have with us today Dr. Betsy McCaughey. She is former Lieutenant Governor of the state of New York. She's a constitutional scholar, and she's the author of a great book, Beating Obamacare, Your Handbook for Surviving the New Health Care Law. There's a picture of it there on the screen. This is probably a must-read. You may want to check it out at Barnes & Noble or at Amazon.com. And Betsy, nice to have you with us today. How are you doing?
Well, thank you. I am so glad we can talk because so many people are getting clobbered with the unexpected consequences of the Obama health law. And I wrote this book, Beating Obamacare, as a walkthrough, a way of guiding everybody through the next 18 months so you won't be hit with that penalty you didn't know about, or you won't get worse care than you are planning on getting at the hospital, know how to protect yourself in the doctor's office. It's a really practical guide.
Can we do it? Can we beat it?
Well, first of all, before we talk about politics, there are definitely things that everybody, no matter what their political views are, need to do to protect themselves and their families from the unintended consequences of this law. Let me give you an example. If you're a baby boomer and you're in your 50s or early 60s, line up your doctors now, your cardiologist, your internist, even if you're healthy, because if you wait until you go on Medicare, you won't be able to find a doctor willing to take you on as a patient. That's how little doctors are going to be paid under Medicare. And the reason is that cuts to Medicare pay for over half this law.
Wow. Wow. All right. What about people who already have health insurance? How will it impact them?
Well, most people get their health insurance at work, either at their own job or their spouse's job, and they've got real trouble ahead. In fact, for many people, it's already happening, and here's the reason. The law says that beginning in January 2014, employers with 50 or more full-time workers have to provide coverage or pay a penalty, but it's not just any coverage. It has to be this one-size-fits-all government-designed plan that costs about twice as much as what employers currently offer. So many employers are saying, I can't afford that. I'm going to dump coverage and pay the penalty instead. So millions and millions of people who got their coverage at work, especially people in retail, in restaurant businesses, hotel businesses, but even people working for the government, are hearing that they've got to go find coverage somewhere else because their employer is dropping them.
Yeah, and you're hearing more and more about that, and especially some of the mandates that it's forcing people to do. So how is this going to impact, say, families? I mean, can we afford this thing?
Well, premiums are going to be a lot higher than they were in the past. The IRS says that the cheapest plan on the state health insurance exchanges is the bronze plan. A family of 5 is going to have to pay at least $20,000 a year for that plan. Now, some people will be eligible for subsidies, at least in some states, but it is going to be very costly insurance. And young people in their 20s and early 30s, they're being forewarned now that their premiums are going to double.
Wow. What about seniors?
Well, seniors get clobbered the hardest under this law. I've got the law right here on my desk, all 2,572 pages, and when I pick it up, I say, cuts to Medicare pay for over half this gigantic law, cuts to senior care. And so seniors really are going to notice a difference. For example, Section 3000A of this law actually awards bonus points to the hospitals that spend the least per senior. Now think about that. Bonus points for spending the least per senior. I wouldn't even take my beloved dog to the vet that spent the least per animal. So why would I take my mother to the hospital that spends the least per senior?
Unbelievable.
So we have a lot of evidence from, not from political magazines, but from medical journals like the Archives of Internal Medicine and the Annals of Internal Medicine, that the hospitals that are the low spenders, the ones that are getting rewarded under this law, actually have substantially higher death rates for seniors. In other words, a senior who goes to that kind of hospital with a heart attack or pneumonia has a much worse chance of surviving that illness and making it home again.
All right, so how can we beat this? I mean, what can a family do? What can seniors do? Is there a way to protect ourselves?
There are lots of things to do. And as I said, that's why I wrote Beating Obamacare.
Yeah.
Privacy is a major consideration because everybody talks to their doctor about things they wouldn't discuss with anybody else. They confide in their doctor. And we've always been confident that that's where it stays, right in that doctor's files. But now the law requires doctors to enter your medical information and your medical history into this electronic database that's going to be part of a national system with each patient having a page. Well, that means that thousands of people are going to see things you thought you were telling only your doctor. So now is a really important time to have a chat with your doctor about keeping 2 sets of books and keeping some of those really private things private.
Wow. You know, what's so interesting to this whole thing to me, Betsy, is this. When, back in the Clinton administration, they call it Hillary Care, and I think it was around 1,300 and something pages.
Right, 1,362. I still have that one right here in my office.
Wow. And but certainly President Obama wasn't smart enough to sit down and write this whole thing. It seemed to be sitting there waiting for him to come in the office.
It was cobbled together by many staffers in Congress, and that's why so few people know what it says. Let's face it, members of Congress didn't read it. I read it, so you don't have to. But the members of Congress who should have read it before they voted on it didn't, and their staffers all contributed different parts of it, and that's why there's so many wrenches in the works. This law is not rolling out smoothly. Even if you're a supporter of it, you would admit that it's not going well.
Do you see a backlash coming from this law?
I do, and in fact, it won't come before January of 2014, but the midterm elections in November 2014, that's when everybody goes to the polls to elect members of Congress and some members of the U.S. Senate. Voters are going to flood the polls to pull that lever against Obamacare because they're going to see how high their premiums are. They're going to see how many people, including members of their own family, have lost on-the-job coverage and maybe even lost their full-time job status. And they're going to see the decline in care in the hospital, and they're going to pull that lever for something else. And fortunately, the Republicans are going to have an alternative ready. So when they pull that lever, it won't mean that the uninsured are forgotten, but that there are ways to help the uninsured without forcing the rest of America to give up on their personal privacy and give up on their job security and give up on their health insurance.
Do you see, with your foresight now, reading both the Hillary Care and this one and your advocacy, do you see this thing being repealed? And if so, what damage does it do to the healthcare community in the meantime?
Well, I see it being defunded after the 2014 election. That's the first step toward repeal. It probably can't be repealed until we elect a new president because there won't be a veto-proof majority in both houses of Congress to repeal it. But defunding it more or less takes its fangs out, prevents it from being implemented. And then in 2016, it could be repealed after the 2016 election. And will we be able to recover? Yes. If it stays in place much longer than that, no. As Kathleen Sebelius told Congress, this law is going to put the insurance companies into a death spiral. But it's going to take several years. It's also forcing many doctors to give up independent practice. You remember when the president said, if you like your doctor, you can keep your doctor.
Yeah.
Well, after about 5 years, you're not going to be able to find your doctor. But for the moment, things are going slowly enough that if we get rid of this law soon, we can protect the American system of medicine. Okay,
because it seems to be damaged at its moment, and then with this being implemented on top of it, what life it had left, it seems to suck it out of it. I'm just wondering.
We can put this on life support for a couple of years, but not much beyond 2016. Voters actually have to take the initiative now in the midterm elections to elect a Senate and a House of Representatives that are committed to getting rid of this law. And it's highly likely because the House is relatively safe in Republican hands.
Right.
And it just so happens that the Republicans have a very strong chance of taking control of the Senate next year.
All right, let me just say to our viewers and listeners, it's called Beating Obamacare, your handbook for surviving the new health care law. This is a must-read.
This is a really practical book.
It's a must-read, and you can check it out.
Under $10.
And Dr. Betsy McCaughey is the author. Before I let you go, do you think that as we progress down the road here, it's been said that we already have a shortage of doctors. What will 2 years of Obamacare do to those who are thinking about going into medicine?
Well, I'm hoping that when doctors see how much resistance there is in the midterm elections, they will hold on. You know, they've spent so many years studying and building up their practices and building up these relationships with their patients that I'm convinced that if they have a glimmer of hope, they will stay in medicine another couple of years. But we have to show them, we the American people, have to show these doctors that we're on their side and that we're willing to fight for our health care system.
Wow. Hey, thank you for your time. Thank you for your work, and I just love your passion for this. I just think that we need the big pushback, and 14 is the beginning of it. 2014
is it. That's when we have to go to the polls and protect our health care system, regardless of whether we're Republicans or Democrats. We all ought to be on the same side on this one.
Well, you know, it's so interesting because the polls still show the majority of Americans don't want Obamacare.
That's right. They don't want it. It's very seldom that you see a law passed, and years later, Americans are just as against it as the day it was signed into law. So I hope everybody will read Beating Obamacare because it's got a lot of protections in it for you over the next 18 months. And let me just say, there's a weasel out there who bought a Google ad and attached my name to another book.
Oh, no.
So make sure that you're buying Beating Obamacare. That's the name of it. It's got my smiling face on the cover. Yeah. Smiling because I think we can beat this.
Well, thank you so much, Dr. McCaughey.
You're
Blessings
welcome.
on you, and thanks for your work.